hear the word depression, it often comes into our mind someone who is crying, sad all the time.
They may not accept that this is depression.
So you mean to say a depressed person may not be aware that he is depressed?
Maybe depression might be going on for 6-7 months. And sometimes they just think this is how life is.
Exercise, is it good for mood or not?
Right now, I'll say harm.
Social media. Namaste everyone. Welcome to yet another episode of podcast with me. I am Dr. Amitabh Kulkarni. This is a platform where we try to simplify complex topic with the help of experts. Today's topic is something which often slips under the radar. Depression. That is obviously not looking like depression. Now when the word depression we hear, it often comes into our mind someone who is sad continuously, who is crying, curling in the bed. But are those the only signs of depressions? We have seen many a times depressed people are someone who is going to work, smiling, shaking hands with you and living a outside normal life just like you and me. But they may be struggling with depression. So today I am very happy. I am joined by Dr. Barjis, who is a leading psychiatrist who has helped numerous cases of depression or mental health disorder, helping them in identifying the disease and a proper treatment. Dr. Barjis is a leading psychiatrist. Dr. Barjis, welcome to our podcast. Thank you for accepting the invitation. Can you tell us something about yourself?
First of all, Dr. Amitabh, thank you so much for this great venture and thank you for inviting me. I'm Dr. Barjis Sulthana. I'm specialist psychiatrist. I've been working in psychiatry since more than last 10 years. And I've done my undergrad and my post-graduation both from India, and right now I'm working in UAE, that is Dubai, and initially I was working back home. And basically I deal a lot of cases with depression and anxiety, bipolar disorders, schizophrenia, eating disorders, and a lot of other form of anxiety. I'm a general psychiatrist, so I also see kids as well as adults.
So very complex disease profile. We are very lucky to have her today. So whether you are a student, a professional person or someone who is just feeling off lately, this episode is definitely going to be useful for you. So let's start with the discussion. Dr. Barjis, when we hear the word depression, it often comes into our mind someone who is crying, sad all the time. Is that the only picture or there is something happening behind the picture?
No, it's not the only picture. Depression is a very complex illness. It can present in very different ways. Most of the times it's not just your loved ones or your friends who don't pick it up. Maybe sometimes you also are not aware that depression is the cause for this.
Correct.
Crying and being sad, yes, it is part of depression. Some people's predominant symptom is that when they're sitting in a setting where they're not thinking anything about sadness or they're not worried or there's nothing wrong going on at that given point, but they feel like they want to cry or tears are rolling down their face. Yes, that is one of the signs of depression. But some people, there are cases who never cries, but they are clinically depressed, maybe having even severe depression. So completely crying as only part of depression, that's a wrong way of putting across the idea of depression.
So you mean to say a depressed person may not be aware that he is depressed? Is it possible?
Yes, there is may not be aware, may not be able to accept.
Denial is there, yeah.
And sometimes they just think this is how life is.
Exactly.
Sadness is part of life.
Sometimes we just accept as it is. Correct. So in that case, someone who is actually depressed but has not accepted or is not aware, what are the subtle signs which we should be, or their loved one should be looking for, or they themselves, if they want to know, they should be looking for in those cases then?
See, first, when we're talking about depression, mainly there are three cardinal symptoms. One is persistent low mood, which can be also expressed as a crying
Correct.
or being sad. The other two are lack of interest in activities or things which they had interest in the past and right now they don't. And the third one is lethargy, which is in plain tiredness, which we mostly miss. Whenever we are tired or we have extreme tiredness and it's been lasting for days, automatically we start thinking it's a physical cause. We start looking for vitamin deficiencies, we go to our cholesterol, our sugars, we look for metabolic problems. Very rarely people attribute it to a psychological symptom, but it is one of the most common psychological symptom because the mental energy or that interest comes from your mind and physically you can feel tired. So one of the most common, which I've seen in clinical practice a lot, people miss, has been there for quite some time, is tiredness. There are also a lot of other subtle signs, for example, with sleep. Sleep can be both ways. People always think, okay, if you're depressed, you can't sleep. But there are people who oversleep. They sleep 14 to 15 hours in a day. But that's also a sign of depression. Even with appetite, we always think they are thin because they've been depressed, they've been not eating. But there's something called emotional eating when it comes to depression. And they try, the eating is used as a coping mechanism and they eat more than what's necessary. So going to symptomatology, there is a lot of symptoms which could be attributed to different other things, but actually it turns out to be symptoms of depression.
Now the symptoms which you described, like I would say 70-80% of the symptom almost everyone must, like feeling like a tired one or not sleeping. So is it only when it is persistent, not settling down without any reason? Because once in a while everyone gets tired, once in a while everyone may not have a good sleep for some reason. Maybe it is a stress at work or something going in the personal life. So like, is it always like, is it only when it is going on for a certain duration or anything like that?
We do have duration as a criteria when we say clinically depressed, but duration is not only the criteria. The other thing which we look into is functioning. How much of this problem is affecting your functioning? And when you're looking into functioning, you look into occupational functioning, social functioning, and self. So you have to be functioning in all these areas, and if there is damage in the functioning, then we go in with okay, this is something we need to.
So if that is affecting your day to day, especially the work life, especially, then it's So there is one term called as a high functioning depression. We also know what is classic depression, which almost all of us. So how do we know whether this is a high functioning depression or classic depression?
See, this is very common, especially in today's. We are living in a very fast world. We have responsibilities. Finances are on our number one list, and we're doing a lot of corporate jobs. All this time, the functioning is high functioning. Depression is possible. They will be doing everything. They're going to work. I get a lot of patients or their relatives ask me, I'm going to work. I am getting my bonuses. I got promotion 3 months ago. So how can I be depressed? But this still can be depressed. See, even though you're going through the motions, you can feel kind of emptiness. The joy you're supposed to feel in achieving all those things may not be there. That can cause lack of motivation, lack of interest. You are going, it feels like you are going through your day in a robotic way rather than being present enjoying.
Or enjoying the work,
Yes.
yes.
So
Yes.
this is very common and this is very missed. Like when
Mhm.
especially happening in high functioning people, they are the providers. So
Right.
for them, it's
Right.
very difficult to accept help
Yeah.
or accept that there is something, going on with me.
So, viewers, please understand, as Dr. Barjis clearly said, that there can be a high functioning depression wherein externally for society the patient may look normal, successful, achieving each and every task which is given to him, but from internally he may not be enjoying what he is doing, and that can be also a subtle sign of depression. Now, many a times we see unnecessary tantrums, anger, numbness seen in people. So, can that also be a sign of depression?
Yes, especially irritability. That's what the term we use for this.
Yeah.
That small things which shouldn't irritate a person
Correct.
irritates them. Patient exactly says, I know this is a small thing, but it irritated me so
Irritates
much.
me.
So that is one of the common symptom which is seen because the basic mood is low. So
Yeah.
you're not enjoying, you're not able to let go of things or understand and move on from certain things. And also especially irritability when talking as a symptom is seen in specific groups.
Okay.
Older people and teens. In teens, depression will look like as a 14-year-old who is very angry or gets angry, is
For no
fighting with
reason, yeah.
fighting with siblings, having fights at the PE, and nobody can figure out what's going on.
Correct.
That is one of the things which people miss, and they are mostly penalized, saying that this is behavioral issues. But this could also be a very beginning stage or subtle stages of depression.
Depression. That's also very, very important. Even irritability without any obvious reason, anger without any obvious reason, especially either in the elderly people or teenagers, can be an early sign. It need not be depression always, but if it is going on persistently, definitely we should seek the opinion of experts. And this is the platform for the same purpose, that even the subtle signs of any particular illness or diseases should be identified, recognized by the, not necessarily by the patient himself, but the near and dear ones, so that the attention is sought in time. Now, Dr. Barjis, we have often seen that someone who is struggling with a particular thing, they often feel guilty or ashamed or to accept that. So even if someone is not able to do that, he is depressed for some reason, he is getting angry for no reason, probably he also is aware about that, but when it comes to accepting the problem, they always feel guilty, or someone, maybe there is some taboo related to this. So why does that happen?
There are a few things regarding this. One is social stigma. As a society, we are not, for generations, very promoting of mental health issues. I know things are changing. There is changes happening with that, but still, when you go and talk about depression or psychosis or somebody having those issues in a society, there is a discrimination. Next bigger problem is internalized stigma. We stigmatize inside ourselves. Like we do not want to accept that we have depression because rather than seeing it as an illness or a disorder or like a fever which requires help or a kidney issue which requires help, we rather see it as our personality weakness.
Correct.
They say that we are not strong enough. That's why we got depression, which is completely not true. Depression is a disorder. It is due to chemical imbalances in your brain and it has treatment. So that, wow, another reason is that. One more last one is that they feel that accepting it or seeking help, sometimes they have a fear of losing their control.
Okay.
So they feel like maybe at job it's going to be an issue, like everybody's going to see me in a specific way, or if I accept this thing to my partner, they may see me differently than what they've been seeing
Maybe
me
their
before.
self-esteem is hurt or something.
They're
like
afraid
that.
of that. They're very fearful. So to an extent that they may not accept that this is depression. Also, they also sometimes, what is the thing, they accept this, we are getting old, this is how life is, or this is a part of
Correct,
life.
correct.
And maybe depression might be going on for 6-7 months, but they have gotten used to that. Now that's their routine, and the help is not available or reached.
Yeah, yeah, or it may not be helpful at all, even if someone is helping. Now, that's a very valid point. Now, many times they don't accept that, they don't want to accept that denial, as we are persistently discussing. So, does it manifest in some other physical, like if they are not accepting the internal things, psychiatric subtle symptoms, does it manifest with certain obvious physical symptoms like loss of appetite or loss of sleep or something like that?
Yes, it manifests because as long as you're having symptom, there is no way that you can keep it inside,
Correct.
locked up forever. It is going to come out one way or
Yes.
the other.
Yeah.
Either it is going to come out as physical symptoms or it's going to come out as mental symptoms. Physical symptoms, pain. Pain is one important symptom. Unexplained pain. You're going from orthopedicians to rheumatologists to everybody,
Wow.
but the pain is not resolving.
Right.
And it is a very non-specific pain. It moves from places to place,
Yeah.
and it is all over your body.
All the investigations are
Restrictions
done, nothing
everything is
found.
normal,
Yeah, yeah.
but you can't figure out what's causing it. One is that. Another very common symptom is gastric irritation, gastritis. Long-standing gastritis is a consequence of depression, which has predominant anxiety symptom. And you're taking treatment, you're better, and then it comes back again. So you've been in that, okay, you go take treatment, get better, but then you have to go back and check whether this is not just gastric irritation, diarrhea and constipation is also one of the physical manifestation when you have anxiety prominent depressive symptom. There are also other symptoms with sleep, which is more like, I think people are more aware when sleep is low, then this is going for depression or appetite is low.
So this is again important point our listeners should know, that maybe you are going to a different doctor with different symptoms, nothing is identified, the doctor may say you have nothing obvious, but then that can be a subtle sign of depression. Now, Dr. Barjis, you said something about teens or teenagers. So, does this depression manifest differently at different age, whether it is a teenage, like whether it is a teenager problem or an adolescent problem or an elderly problem? How does it differ in different generations?
It differs. Like everybody's symptoms predominant is not same. So when you're going to first with very young kids like 7 to 8, 10, they have a lot of non-specific school refusal. They have unexplained stomach pains. They are not making friends. They don't want to be active. They are very lethargic. They pass out in classes, things like that. That is in teens, it's more of externalized symptom where they are more, it seems like they're rebelling against things. They don't listen, they do things which is more like having a contact problem, or sometimes even lying, stealing, things like that. Those are also signs of depression. But when you go into adult, sometimes it's physical symptoms, long-standing, like which I discussed, pain disorders, unexplained headaches, unexplained body pains. Sometimes it's very obvious, you present with low mood, sadness, numbness, lack of motivation. But when you come to old age, depression is agitated depression, where you are like more angry, more irritable, doesn't feel like sitting in one place, keeps walking around, is always talking about something. And also early dementia or pseudo dementia symptoms are seen in, they are not actually dementia because of depression, they have symptoms which looks like dementia, which is presented especially in towards later stages of life.
So discussing the symptoms now, from your practice, from your experience, how often do patient themselves present to you, or is it most of the time either their parents or spouses or children who bring them to you? What is the, like, I don't want a percentage, I would say, but is it more common with the patient coming to you, himself, herself, or some relatives are bringing with all these subtle signs?
What I've seen with depression, patients do come by themselves.
Okay.
I know because also I'm in UAE, there are a lot of people who are living alone here, and maybe that is one
And
reason.
maybe awareness is also increasing.
increased, and recent time the awareness is high. And most of the time, and sometimes your company is having a corporate psychiatry meets or awareness things, which kind of triggers somebody to bring. And also a lot of referrals from gastro, from rheumatology, from other departments where they've been counseled by those doctors, from neurologists, they counseled by neurologists, and they're sent to psychiatry. So these are the main way, but it's a mix.
But that's reassuring to know that nowadays even patients are coming to you directly, identifying probably something is wrong internally with them. Now, coming to these symptoms, can a social withdrawal or someone who is into a hobby, whether it is playing cricket, playing football, photography, or any other reading, sudden lose or sudden loss of interest in these hobbies or a social withdrawal, can it be also a sign of depression?
Yes, like I discussed, it's one of the cardinal symptom. Lack of pleasure in previously pleasurable. That's the term we use for it. It's also called as anhedonia. So we lose interest. So people used to come and say, for example, if a lot of people who are very interested in cooking, they used to come and say, I used to enjoy cooking. I used to try different dishes. But now I just
of late I'm not enjoying
it. I'm just doing it as a work. I just want to get it done with. My friends are calling me. I used to go regularly to play with them, but now I just avoid the call or make up reasons. So this is also one of the symptoms, and it kind of doesn't come all of a sudden. It's a very gradual. It happens so slowly. Sometimes you don't recognize it.
Correct. So in that case, what role does masking play in all these things, whether you are a professional or in any field? So maybe most of these symptoms are masked or not identified. How does that happen? How will that get recognized then?
See, masking is very common. Especially, I've seen a lot of masking in male gender, and sometimes even in the main provider. They do not want to accept because a lot of people is dependent on them, and they do not want to increase other stress and things like that. And sometimes people also believe that my problems are lesser. There are different and more complicated problems for others. And me saying this will not be right. So those are the reasons they start masking. But eventually there is no way that you can mask it for
longer time.
If it is not coming out as a depression, you will end up going to have a physical symptom or something like that.
So masking, you mean to say masking do happen in
very often.
It's very common. So earlier we recognize better for all of us. So are there any certain professions or personality type where it may go unnoticed for longer time? It may be accepted as a part of the day-to-day routine. So is there, from your experience, what is your say about this?
Yes, there are a lot of professions which goes back into high functioning individuals. Corporate jobs where or some type of toxic positivity is available. Like they're like we are happy, we are together, everything is okay,
we are family.
Yes. And that kind of is not very right. It is rather better to accept, see, I had a problem and I dealt with it. That is the positivity we need to look at for. Certain set of people, for example, if you're a perfectionist or you look for perfectionism, because of that need for perfectionism, they are motivated to they are doing those tasks. And so those subtle signs of numbness, emptiness, because the functioning is there because of the perfectionism. Another one is those people who feel very empathetic to others. They are highly empathetic to others, but they cannot find empathy to themselves. So, for example, like I said before, that those people who feel my problems are lesser if you compare to, let's say, another person's problem. He has much bigger problem, and then I should be grateful I have all this. So these are the main groups where I see a lot of masking, a lot of difficulty in acceptance, because it's also very important for treatment. The first stage in treatment is accepting these are my problems. We cannot work through those problems if you don't know what they are.
So from this discussion, now I am feeling that probably the depression is a lot more prevalent than what we are actually seeing, because many of these corporate culture or corporate etiquettes or whatever ethics, maybe we are hiding so many symptoms, presuming this is the part of our work culture, part of our life, part of this corporate things. So now in corporate, obviously everyone is professional with each other. So probably your colleague may not be able to identify, because probably they are also dealing with the same issues. So then how do the near and dear ones spot these signs? Like I will not expect colleagues to identify this, although they can, but my say would be like only the family or friend will be able to spot these early signs. So what are those early signs which your relatives or friends would be able to identify in you, which you may not be aware at all?
These are the signs which are very not visible. These are the ones like withdrawing slowly, not accepting, missing your calls. You plan to meet up, not making the appointments. Suddenly saying, suddenly not involved in the discussions which is happening. Frequent other. Frequently getting sick, frequently going to hospitals. That energy you can't feel from them. It's just they sometimes be physically there, but then you feel like they're not mentally present. Sometimes even making like silly or smaller kind of mistakes in like missing things, missing dates. Those are the things which you can pick up, and sometimes friends can pick up very early. And a lot of patients do present because friend has told they've noticed this. So maybe they also know to an extent, but then the last push is generally given by that friend asking, and then they reach to help, and then makes a big difference.
So the role of probably near and dear ones becomes very crucial in this. Now there is often in our day-to-day term burnt out. I am burnt out. Whether you are a working professional, whether you are a homemaker, whether you are a student, you often hear this term. We also hear getting tired and all those things. So how do we know whether this burnt out symptoms, just tired is just a depression, or it's just the normal occurrence?
See, starting with tiredness, it's just physical exhaustion. Mentally, you still want to do things, you still want to do, but physically you're exhausted. You take rest, you're back, you can continue doing whatever you were doing. But when coming to burnout, it's more longer. Like you constantly, every day morning you wake up, oh, I have to deal with this, I have to do that. There's a lot of emotional detachment from the task or work or whichever is burning you out at that point. You stop enjoying the work. It rather becomes like you look forward to your weekend, look forward to time off. It's as if like you're working from time off to next time off. It goes like that. But when you're away from it, you've gotten a break, you go back to yourself, you enjoy your things. So that's burnout. But prolonged burnout will end you up in depression. But depression is a cluster of a lot of symptoms. It's multiple symptoms in different area with social and occupational dysfunction. So that is when we call it depression. But very closely, I've seen a lot of patients who initially was presenting with burnout as slowly got converted into a long-term depression. And that time period we cannot specify. It may be 2 months for somebody, it may be 8 months for somebody else, or maybe 1 year. It can happen anytime.
Yeah. So it need not be depression all the time, but if it is actually affecting your day-to-day work, or if it is getting prolonged for no reason, definitely we should be looking for depression in these people. So then, how often do these patients actually present to you with these symptoms of depression, or they just come with the vague things in your clinic? How often?
It's mostly equal. Some people do come and say, I think that's, even though I'm not big advocate of social media and increased use of social media, no, but then like social media has got a lot of role to play in that. They do come and say that I am feeling low, I am feeling sad, I'm not enjoying. But like there are a lot of other people who just want to check that they've been tired. Is that a depression? Or somebody told that my tiredness was not getting treated. You should see a psychiatrist. So why should I see psychiatrist? How can it be depression? They are in that stage. So we start like from basically explaining what are the symptoms, how it, what's the chemical or what's the neurotransmitters behind it, and then we go on from there.
Correct. So visiting a psychiatrist with some obvious symptoms need not be a social stigma, and people should accept that they have subtle signs of depression, or there may be a depression, and taking the help of the expert in the field. Just like you have fever, cough, you are going to an expert in that field. Subtle signs of depression, if you are able to identify, it is always wise to visit a psychiatrist and take the help. Now many a times we just feel off on one particular day, not in a great mood on that particular day. So is it always the early sign, or it may not be anything otherwise?
No, we can feel off. We can feel off and we can feel sad. We just want to lie down, taken off that day, spend the whole day in the bed. That's not depression. It's when it consistently happens along a long period of time, along with some other more symptoms, including like lack of sleep, lack of appetite, energy, tiredness. All those things needs to come. And feeling sad is okay, and if you let it happen and you bounce back from it, it's okay. It's part and parcel of your life.
So someone, this will be the last question for today's discussion. I think it's going so fast and it's so relatable to most of us. The last question I want to ask is someone who may be going through some sort of negativity in life, feeling tired, not feeling energetic. What professional advice would you give it to them, so that nothing is missed from depression point of view, and they should take the help of the expert ASAP, as soon as possible?
Yeah, you've been struggling with low mood, or you're struggling with emptiness, numbness, or a lot of unexplained physical problems, or problems in concentration, your functioning has come down. It's better to check it with an expert, because depression can be devastating if it's left untreated. And one important time is duration, from onset to duration of, like from onset to symptom. From onset to treatment, how long it is. The longer it is, the more difficult it becomes. So it may be like a initial stage, you might just may need only therapy. You don't need any medication or need anything which is very long term, or something which is maybe it's just few consultations with a specialist or with a psychologist or with the counselor. Anything, it will change, and it changes a lot of things for you if it is treated on time.
So that brings end of this interesting episode with detailed discussion. Now we have added one more segment in our podcast, and this is going to be a light-hearted discussion, wherein these are genuine questions, but it's a quick answer, either yes or no, or a single word So are you fine with
Yes,
this?
yes,
Yeah,
yes.
yeah. So these are some of the questions which needs an immediate answer. Dr. Barjis, do you think everyone feels low sometimes?
Yes.
Yes. So this is a quick yes answer. Uh, Exercise, is it good for mood or not?
Very good.
Very good.
Best.
Very good, best. Yeah. So that's also very important. Now we have seen, can pets really lift your mood?
Yes, it can, but it's not a solution for your depression.
Yeah, it can, but it's not a treatment, of course. Social media, this can be a gray zone. Will it help? Does it help or does it harm?
Right now, I'll say harming.
Right now, it's you are seeing more. I'm sure you are the one who is seeing all the side effects of social media. So, if you had to choose, what will you choose? A therapy, a discussion, or medicines?
First choice therapy.
First choice should always be therapy. Yeah, good, good. Is talking to a friend, making good friends, can it be as powerful as medicines? Yes or no?
Yes, but it's not replacement.
Yeah, again, it's not a replacement. Yeah, maybe for the time being, it may helpful. Is sunshine a good mood booster?
Yes, it is a mood booster. It's a
Okay.
very good mood booster.
Okay, okay. Now we have often heard chocolate. Yeah, does it make you feel happy from inside or not?
Chocolate, yes. Sugar, no. So it's a tricky
Maybe
one. I
dark
don't know how
chocolate.
you. Yes, maybe.
Maybe
How do
dark
you
chocolate.
find chocolate without sugar? So.
Yeah, yeah. Is laughter really a antidepressant? Yes or no?
It's a booster dose, not the main dose.
Not main dose. We see lot of laughter clubs
Yeah. It is a booster.
everywhere.
It can improve your mood, but may not get you out of depression.
Okay, okay. Thank you for answering this short question. Now, this brings the end to this deeply insightful discussion with Dr. Barjis. I'm very happy she answered it clearly. In this discussion, we found out that depression may not be always obvious and what we see in movies or TV series, but there can be so many subtle signs of depression, whether it is social withdrawal, losing interest in hobbies, unnecessary irritability, throwing tantrums, loss of sleep. There are so many signs which we see every day, but we may not be able to identify because we as a general person may not be aware about this. But I'm sure after today's episode, many of those people with subtle signs of depression or someone whose relatives may have identified these subtle signs in their near and dear ones, this episode is definitely helpful for them. If you liked this episode, please like and share it with someone who is probably going through these signs, or someone's relative who is going through this sign. I'm sure at the end of this podcast you have learned something new. Remember, prevention is always better than cure. So if you uh, identify these signs at the early stage, as Dr. Barjis clearly said, that initially we try a discussion rather than direct medicine. So sometimes even with the discussion and all, it may be helpful for a patient in early signs. So I'm signing off with Dr. Barjis for today's episode. Take care of your health and see you next time. Thank you.
Thank you so much.
Thank you.